In this video, we will be studying about real strategies to select right options in multiple options questions 99% of the time. First, we will study the strategies. Then we will see with practice example and try to use the strategies we learned to answer each question. We are going to see 8 most important strategies in this video. Let's see the very first strategy, and this is also one of the most important strategies. Identify the correct number of answers. Pay close attention to instructions on how many answers to select, especially for select all that apply SAT questions. If that is written in the question, there would be multiple answers for sure. I will explain the steps to approach the multiple options questions in this example, so please be focused on the case. A 45-year-old female with a history of type 2 diabetes mellitus presents to the clinic with complaints of dizziness, excessive thirst, and frequent urination. Her blood glucose level is found to be 400 mg per deciliter, and she appears slightly dehydrated. Select all the complications of uncontrolled diabetes that are relevant for this patient. Select all that apply. Option 1. Diabetic ketoacidosis. Option 2. Retinopathy. Option 3. Nephropathy. Option 4. Hyperglycemic hyperosmolar state. Option 5. Hypoglycemia. You can take your time to go through the question and pause the video here. There are 2 right answers to this question. 1. Diabetic ketoacidosis, and 4. Hyperglycemic hyperosmolar state. Strategy to select the best answers. First, identify the correct number of answers. The question is a select all that apply, SATA, which means you need to identify all the complications that are relevant to the patient. It's essential to read the instructions carefully to avoid underselecting or overselecting. In this case, there are 2 correct answers indicated by the instruction. Second, focus on the patient's symptoms and history. The patient has a blood glucose of 400 mg per deciliter, which is very high, and symptoms like dizziness, thirst, and frequent urination that indicate severe hyperglycemia. This points towards diabetic ketoacidosis or hyperglycemic hyperosmolar state, which are both associated with extremely high blood glucose levels. Third, eliminate irrelevant options. Retinopathy. Option 2. While retinopathy is a long-term complication of poorly controlled diabetes, it does not correlate with the acute symptoms presented in this case, dizziness and excessive thirst. Nephropathy. Option 3. Like retinopathy, nephropathy is a chronic complication and does not match the acute clinical picture of this patient. Hypoglycemia. Option 5. Hypoglycemia is typically characterized by low blood glucose levels, which contradicts the patient's elevated blood glucose of 400 mg per deciliter. Then in the end, match symptoms to acute complications. The patient's elevated blood glucose level and dehydration suggest the acute complications of diabetic ketoacidosis or hyperglycemic hyperosmolar state, HHS, both of which can occur in poorly controlled diabetes. DKA is more common in type 1 diabetes, but can also occur in type 2 diabetes, while HHS is more common in type 2 diabetes. By carefully noting that there are 2 correct answers, you can focus on the acute complications related to high blood glucose levels, such as DKA and HHS, and avoid chronic complications like retinopathy and nephropathy, which are less relevant to this patient's current clinical presentation. Understanding the acute versus chronic nature of diabetes complications is key in selecting the correct answers for SATA questions. Strategy 2. Use the elimination method. Using the elimination method involves critically analyzing each option in a multiple choice question to narrow down to the most plausible answers. Let's see an example. What are effective treatment plans for managing asthma exacerbation in the emergency department? The options given in the screen are Option 1. Administering oxygen. Option 2. Giving a high-dose inhaled corticosteroid. Option 3. Administering a bronchodilator. Option 4. Giving oral antibiotics. Option 5. Administering a high dose of diuretics. Option 6. Providing intravenous fluids. Option 7. Giving a sedative. You can pause the video now if you need time to go through the options. Let me explain the answer to this question. Option number 1. Administering oxygen. This is correct. Oxygen is often administered to patients with asthma exacerbations if they are hypoxic, which is basically true in emergency cases. This is a safe and effective initial intervention to maintain adequate oxygenation. There is no elimination rationale for this answer. It's a correct and essential part of initial management. Option 2. Getting a high-dose inhaled corticosteroid is incorrect. While corticosteroids are used to reduce inflammation in asthma, high-dose inhaled corticosteroids are not typically given immediately during an acute exacerbation. Systemic corticosteroids, or a combination with bronchodilators, is often preferred at the onset of an exacerbation. The reason to eliminate is the option describes a treatment method that is not aligned with the immediate management steps of an asthma exacerbation. Option 3. Administering a bronchodilator is correct. Bronchodilators like albuterol, which is a beta-agonist, are the first-line treatment in asthma exacerbation to relax the bronchial muscles and improve airflow. It's a cornerstone of asthma management in acute episodes. There is no elimination rationale for this answer. It's a correct treatment for immediate relief. Option 4. Giving oral antibiotics is incorrect. Antibiotics are not used to treat asthma exacerbations unless there is an underlying bacterial infection, which is rare. Asthma exacerbations are primarily due to inflammation and bronchoconstriction, not infection. Antibiotics are irrelevant in this case unless there's clear evidence of infection, which isn't mentioned in the scenario. Option number 5. Administering a high dose of diuretics is incorrect. Reason to eliminate is diuretics are used in conditions like heart failure, not asthma exacerbations. This option is irrelevant and doesn't align with the management of asthma. This treatment is not appropriate for an asthma exacerbation. It's used for fluid overload, not bronchoconstriction. Option number 6. Providing intravenous fluids is incorrect. While intravenous fluids may be indicated for dehydration or to maintain electrolyte balance, they are not part of the immediate treatment for asthma exacerbations unless there are other complicating factors like dehydration. The elimination rationale is intravenous fluids are not the first-line intervention for asthma and do not address the underlying cause of the exacerbation. Option 7, getting a sedative is incorrect. Sedatives can worsen respiratory depression and airway patency issues. During an asthma exacerbation, sedation is contraindicated as it may compromise respiratory effort. Elimination rationale is sedation should be avoided as it may compromise the patient's ability to breathe effectively, making this an unsafe choice. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the next-gen NCLEX-RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next-generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Let's see another strategy. Read the question stem carefully. Take your time to thoroughly understand the question's intent before looking at the answer choices. For example, suppose if the question asks about symptoms of shock, identify whether it pertains to hypovolemic shock or septic shock, as the symptoms and interventions differ significantly. A 65-year-old male with a history of hypertension and recent pneumonia presents to the emergency department with hypotension, tachycardia, and fever. He is also confused and his skin is warm and flushed. Which two symptoms are most indicative of septic shock in this patient? 1. Hypotension. 2. Tachycardia. 3. Cold, clammy skin. 4. Fever. 5. Decreased urine output. The correct answer to this question are 1. Hypotension and 4. Fever. Let's see the strategies to select the right answer. 1. Read the question stem carefully. The question specifies the patient is presenting with hypotension, tachycardia, and fever, but it asks specifically about the symptoms indicative of septic shock. This is important because septic shock has specific features such as warm, flushed skin, not cold, clammy, and fever, both of which are common in sepsis. 2. Focus on the type of shock. The patient's warm, flushed skin and fever are key signs of septic shock, where the body typically has a wide vasodilation, leading to warm skin rather than the cold and clammy skin seen in hypovolemic shock. Understanding the distinction between shock types can guide your choice of symptoms. 3. Eliminate irrelevant options. Cold, clammy skin, option 3 is more indicative of hypovolemic or cardiogenic shock, where there is a decrease in circulating blood volume or cardiac output, leading to peripheral vasoconstriction. Decreased urine output. Option 5, while common in shock, is not as specific to septic shock compared to other hallmark symptoms like fever and hypotension. 4. Match symptoms to pathophysiology. By understanding the pathophysiology of septic shock, we know that the body often tries to fight infection with a fever and compensates for low blood pressure with an increased heart rate, tachycardia. Therefore, hypotension and fever are the more specific symptoms associated with septic shock in this case. Let's see the another strategy. Look for keywords in the question. Identify guiding terms like best, first, most likely, and least likely. A 62-year-old male patient with a history of chronic obstructive pulmonary disease (COPD) presents to the emergency department with complaints of worsening dyspnea and difficulty breathing. His oxygen saturation is 88% on room air. He appears anxious, is using accessory muscles to breathe, and has diminished breath sounds bilaterally. Which intervention is most appropriate for this patient with dyspnea? The options given on the screen are: Option A, encourage the patient to perform pursed lip breathing. Option B, administer oxygen via nasal cannula at 2 liters per minute. Option C, place the patient in the supine position to conserve energy. Option D, obtain an arterial blood gas, a BG sample. Take some time to read through the question, but let me answer the question. The correct answer is B, or administer oxygen via nasal cannula at 2 liters per minute. But can you explain why I have chosen this as the most appropriate answer? Please write in the comments below. Let's see another strategy. Prioritize the options based on nursing judgment. Base your choices on nursing priorities such as safety, urgency, and the ABC framework: airway, breathing, circulation. For example, a patient experiencing chest pain, prioritize call for immediate ECG over administer pain medication, as identifying the cause takes precedence. Let's see a practice question. A 72-year-old male patient is admitted to the emergency department with chest pain and shortness of breath. He has a history of hypertension and coronary artery disease. On examination, the patient appears anxious, his blood pressure is 150 by 90 meters mmHg, his heart rate is 110 beats per minute, and he has a low-grade fever of 100.5 degrees. The healthcare team is about to assess the patient further. What is the priority nursing actions in managing this patient? Select all that apply. Option 1. Administer oxygen via nasal cannula. Option 2. Administer aspirin to prevent platelet aggregation. Option 3. Obtain an ECG to assess for ischemia. Option 4. Administer pain medication to relieve discomfort. Option 5. Administer IV fluids to increase blood pressure. Option 6. Monitor vital signs and assess pain levels. Option 7. Start a chest X-ray to assess for lung pathology. There are 3 correct answers here. 1, 3, 6. Let's see the rationale. 1. Administer oxygen via nasal cannula. This is correct. Oxygen is a priority in any patient presenting with chest pain and shortness of breath to ensure adequate oxygenation. It helps reduce the myocardial oxygen demand and supports circulation, which is essential for a patient with potential cardiac ischemia. Administering oxygen is crucial to address potential hypoxia and maintain the patient's respiratory status. 3. Obtain an ECG to assess for ischemia. This is correct. The most urgent step for a patient with chest pain and a history of coronary artery disease is to obtain an ECG to rule out myocardial infarction MI, or ischemia. This test will help identify any life-threatening arrhythmias or infarctions. In accordance with the ABC framework, airway, breathing, circulation, the circulatory aspect, cardiac assessment, is the priority here, followed by oxygenation. 6. Monitor vital signs and assess pain levels correct. Monitoring vital signs is essential in evaluating the patient's clinical status and identifying any changes. Assessing pain levels will help determine the severity of the chest pain and guide further management. Regular monitoring allows early detection of worsening symptoms, including changes in heart rate, blood pressure, and pain level, which are critical for patient safety. 2. Administer aspirin to prevent platelet aggregation. Incorrect. While aspirin is important in the management of suspected acute coronary syndrome, SCS, it is not the first step in management. The priority is to assess the heart's electrical activity with an ECG and to oxygenate the patient first. Aspirin can be given once an ECG confirms SCS. This step is important but secondary to ensuring oxygenation and ruling out MI with an ECG. 4. Administer pain medication to relieve discomfort. Incorrect. Pain relief is important, but before administering pain medication, it is critical to confirm the underlying cause of the chest pain, ED, myocardial infarction, angina. Administering pain medication without this assessment could mask important clinical symptoms. Pain relief is a secondary concern compared to determining the cause of the chest pain and ensuring adequate oxygenation. 5. Administer IV fluids to increase blood pressure. Incorrect. The patient's blood pressure is currently elevated 150 by 90 meters mmHg, and administering IV fluids could exacerbate hypertension or contribute to fluid overload. The priority is not to increase blood pressure, but to assess the cause of the chest pain and monitor circulatory status. The patient's current blood pressure does not indicate the need for IV fluids at this stage. 7. Start a chest X-ray to assess for lung pathology. Incorrect. A chest X-ray may be useful if there is suspicion of lung pathology, but the priority in this case is to assess for potential cardiac issues as the patient's symptoms suggest a higher likelihood of a cardiovascular event. A chest X-ray is not as urgent as obtaining an ECG, which is crucial for diagnosing potential myocardial infarction or ischemia. The priority actions for this patient are to administer oxygen, obtain an ECG, and monitor vital signs and pain levels. These steps align with the ABC framework, focusing first on circulation and oxygenation, followed by monitoring for any significant changes in the patient's clinical condition. All other options, like administering aspirin, pain relief, and IV fluids, can be addressed once the immediate concerns are managed. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. Another strategy: consider all options before making a final decision. Even if you're confident about 1 or 2 answers, read all options to ensure the best fit. A 58-year-old male patient with a 10-year history of type 2 diabetes mellitus presents to the clinic for his routine checkup. His blood glucose levels have been well controlled with medication, but he reports occasional blurred vision and has been feeling fatigued lately. He is also concerned about some recent numbness in his feet. On physical examination, the patient has decreased sensation in both feet and mild retinal changes upon fundoscopy. Which of the following are potential complications of long-term diabetes mellitus? Select all that apply. Option 1. Retinopathy. Option 2. Nephropathy. Option 3. Diabetic ketoacidosis. Option 4. Peripheral neuropathy. Option 5. Hypoglycemia. Option 6. Stroke. Option 7. Myocardial infarction. The correct answers to this question are 1, 2, 4, 6, 7, but can you explain why? I will give you some tips. Read all options carefully. Even if you're confident about 1 or 2 complications, don't stop at the first few options. It's important to read all the available options to ensure the best possible answer, as diabetes can cause both acute and long-term complications. Focus on long-term risks. In this case, the patient has long-term diabetes, 10 years, and the key focus should be on chronic complications such as retinopathy, nephropathy, and neuropathy. These are common long-term complications of diabetes that affect multiple organ systems over time. Consider systemic effects. Diabetes not only affects the eyes, retinopathy, and kidneys, nephropathy, but also the nervous system, neuropathy, as shown in the patient's symptoms of numbness in the feet. Additionally, patients with diabetes are at increased risk of stroke and myocardial infarction due to the associated risks of vascular damage and atherosclerosis. Eliminate acute complications. Diabetes-related complications like diabetic ketoacidosis, DKA, and hypoglycemia are generally acute events, whereas this patient is presenting with chronic symptoms. DKA is unlikely in this case because the patient's blood glucose is well controlled and there's no indication of acute distress, making DKA an incorrect choice here. Ensure you don't miss any relevant option. Stroke and myocardial infarction are often overlooked but are important long-term complications of diabetes due to the increased risk of atherosclerosis and cardiovascular disease. Don't ignore these options, even if you tend to focus more on complications like retinopathy or neuropathy. Let's see the next strategy. Use knowledge of nursing priorities. Think in terms of what is most critical for the patient's survival and well-being. For example, for a patient in respiratory distress, answers related to airway management, administer oxygen or elevate the head of the bed, should take precedence over non-urgent measures like education. A 65-year-old male patient with a history of chronic obstructive pulmonary disease presents to the emergency department with worsening shortness of breath, increased sputum production, and a productive cough that has lasted for 3 days. His respiratory rate is 28 breaths per minute, oxygen saturation is 88% on room air, and he is using accessory muscles to breathe. The patient appears anxious and is unable to speak in full sentences due to difficulty breathing. The healthcare provider suspects an acute exacerbation of COPD. What is the priority nursing action for this patient? Select all that apply. Option 1. Administer supplemental oxygen to maintain oxygen saturation above 90%. Option 2. Encourage the patient to perform deep breathing exercises. Option 3. Elevate the head of the bed to facilitate easier breathing. Option 4. Administer a bronchodilator as ordered. Option 5. Provide education on smoking cessation. Option 6. Monitor vital signs every 15 minutes. Option 7. Administer oral corticosteroids as ordered. There are 4 correct answers here. 1, 3, 4, 6. Strategies used to select the best answers. 1. Use nursing priorities based on patient needs. The patient is in respiratory distress, which means immediate interventions should focus on improving airway and breathing first. Therefore, options like administering supplemental oxygen, 1, and elevating the head of the bed, 3, are critical and should be prioritized over non-urgent actions. According to Maslow's hierarchy of needs, the patient's physiological needs, airway, breathing, oxygenation, should take precedence over needs related to education or other aspects. 2. Focus on the ABCs: airway, breathing, circulation. In this case, airway and breathing are the most urgent concerns. Ensuring the patient has adequate oxygenation and managing the exacerbation of COPD are top priorities. Administering a bronchodilator, 4, helps improve airflow and is essential for managing the acute COPD exacerbation, improving the patient's ability to breathe and reducing discomfort. Monitoring vital signs, 6, is also crucial for assessing the patient's response to treatment and detecting any further deterioration in respiratory function or circulation. Eliminate non-urgent or lower priority options. Encouraging deep breathing exercises, 2, can help manage anxiety and improve lung function over time, but is not the immediate priority in this patient's acute distress. This is more relevant once the patient's breathing is stabilized. Education on smoking cessation, 5, while important for long-term management, is not the priority during an acute exacerbation of COPD. The patient's immediate survival and well-being depend on addressing their respiratory needs rather than focusing on lifestyle changes at this moment. Administering oral corticosteroids, 7, can help reduce inflammation and improve breathing, but it is not as immediately effective as oxygen and bronchodilators in stabilizing the patient's condition during the acute episode. Avoid overthinking or second-guessing. Trust your first instinct unless you find substantial evidence to reconsider. If you initially select assess vital signs as the first step for a patient reporting dizziness, avoid second-guessing unless a more immediate safety intervention is evident. Overanalyzing can lead to unnecessary doubt and incorrect answers. A 65-year-old female patient with a history of hypertension and diabetes presents to the emergency department with dizziness and lightheadedness. She is alert but complains of feeling faint upon standing. Her blood pressure is 90 by 60 meters mmHg, heart rate is 105 beats per minute, and respiratory rate is 18 breaths per minute. Question: what is the first priority nursing action for this patient? Option 1. Assess vital signs. Option 2. Administer IV fluids. Option 3. Initiate a head CT scan. Option 4. Obtain an ECG. Option 5. Encourage the patient to lie down. Option 6. Provide oxygen via nasal cannula. Option 7. Administer antihypertensive medication. Can you write the correct answer to this question? I will mention them at the end of this video. You can take your time or pause the video. Strategy to select the best answer. Trust your first instinct. When encountering a clinical scenario like this, it's natural to focus on immediate priorities. The patient is presenting with dizziness, a symptom that could be indicative of low blood pressure or other circulatory issues. Your first instinct should be to assess vital signs, which are essential to determining the severity of the problem. If you think vital signs should be assessed first, trust that decision unless you encounter strong evidence to reconsider. Avoid overthinking. Overanalyzing the situation can lead to unnecessary doubt. In this case, assessing the vital signs is the logical first step because it will provide immediate information on whether the dizziness is related to a drop in blood pressure or another issue. Second-guessing could make you doubt this basic, foundational assessment and delay intervention. Focus on immediate priorities. While options like administering IV fluids or providing oxygen are relevant, they are not the first step unless the patient's condition dictates it. For example, IV fluids are typically given after assessing vital signs to address hypotension, and oxygen would only be administered if there were signs of hypoxia, which isn't indicated yet. Administering antihypertensive medication is counterproductive in this case because the patient is hypotensive, not hypertensive. Be cautious of overcomplicating the situation. A head CT scan is unnecessary in this scenario unless there is suspicion of a neurological event, which is not apparent. Similarly, an ECG could be useful later to assess cardiac function but isn't immediately necessary in the face of low blood pressure. Rationale for elimination. Option 2. Administer IV fluids. Incorrect. This is a reasonable action if the vital signs indicate dehydration or hypotension, but it's premature without confirming the patient's status through vital signs first. Option 3. Initiate a head CT scan. Incorrect. A head CT scan is unnecessary without neurological symptoms like confusion, headache, or trauma. Option 4. Obtain an ECG. Incorrect. Although useful for cardiac issues, the primary concern in this case appears to be hypotension, not a cardiac rhythm issue. Option 5. Encourage the patient to lie down. Incorrect. While this can help in cases of dizziness due to orthostatic hypotension, it does not replace the need for an assessment of vital signs. Option 6. Provide oxygen via nasal cannula. Incorrect. Oxygen is not indicated unless there are signs of hypoxia or respiratory distress, neither of which is noted in this case. Option 7. Administer antihypertensive medication. Incorrect. The patient's low blood pressure suggests that antihypertensive medication is inappropriate and could worsen her condition. If you're watching this video and feeling the pressure of tackling those challenging NCLEX-RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX-RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX-RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below.